A very warm welcome to each and every one of you who is joining us today at FORESIGHT Global Health Talks. This is your host, Ria Lobo from the FORESIGHT Global Health team, and I look forward to taking you through this important discussion that reminds us that the future is now. We will be discussing next steps to investing in healthy populations for NCDs and mental health. As most of you know, people with NCDs, including cardiovascular diseases, diabetes, and cancer, have a higher risk of developing severe COVID-19 disease. And what makes matters worse is that they are more likely to die from COVID-19. And while we should have always been prioritizing mental health, now, more than ever, we need to talk about mental health in the context of lockdowns that have been taking over the world and what limited social interaction is doing for our mental well-being. And on that note, I am very excited to introduce our truly esteemed panel today. We are joined by Nina Renshaw, who is responsible for leading NCD Alliance's global policy and advocacy work. Nina has over 12 years of experience in environment, transport, industrial policy, taxation, and health. She previously worked as Secretary General of the European Public Health Alliance and has served as a board member for several NGOs, including the Health and Environment Alliance. She has represented civil society on advisory groups to the WHO and OECD, among others. Thank you for joining us, Nina. We are also joined by Lee Yin, who is a passionate advocate for people living with mental health disorders. She is trilingual. Yes, she is. She speaks 3 languages, Mandarin, English, and Bahasa Malaysia. She holds a bachelor's degree in marine science and is currently pursuing her master's degree in marine chemistry. Lee Yin has been living with depression since she was 14 years old, and this eventually led to self-harm. Through her own experience as a person living with depression, she believes she can help raise awareness so that others will not have to go through it alone, as she had. We are so happy to have Lee Yin join us today, who has turned her pain into power and will be helping hundreds of people with her powerful voice. Thank you, Lee Yin. And like they would say, welcome in Malaysia, Salamat Datang. Our next speaker is Austin Davis. He has been an advisor on health issues since 2013 in NORAD, which is the Norwegian Agency for Development Cooperation. He has worked in diverse areas, including risk factors related to health and universal health coverage. He has previously worked at MSF in various capacities, including General Director of MSF Holland. Austin has also worked for UNICEF in Somalia, the Norwegian Refugee Council, and as a consultant. I don't think anyone will disagree with me that this is truly a power-packed panel, and I can't wait to get started. I'm going to start with you, Nina. Could you tell us why NCD should be prioritized within and outside the context of COVID-19?
Thanks so much, Rhea, for having us on the panel this afternoon. It's a pleasure to join you. And really timely that we talk about this today. As you were saying just now, I mean, NCDs have very strongly shaped the course of the pandemic around the world, and people living with NCDs have been severely impacted everywhere. We've really experienced COVID-19 as what's called a syndemic, so a clash of pandemics, not only COVID-19 itself, but health inequalities at the same time, and NCDs have been the vector and the people that have been in many cases worst affected. So the vast majority of the 2.6 lives lost already have been people living with underlying health conditions, and those have most commonly been hypertension, cardiovascular disease, and diabetes. And there are other ways that the NCD community has been disproportionately impacted by the pandemic as well. So people living with NCDs have in many cases been cut off from essential care, whether that's screening, treatment, diagnosis, rehabilitation, palliative care services. Essential care services, WHO has found by doing some surveys, have been severely disrupted in almost all countries. And that ranges from about half of countries reporting disrupted services for cardiovascular emergencies, including heart attacks and stroke. 2/3 of countries reporting disruptions for hypertension management and diabetes treatment. And obviously, if your treatment is interrupted, this can have very, very severe life-changing complications and even worse outcomes than that. And almost all countries, 93%, reported disrupted or entirely halted mental health care. So time will tell, but that long-term toll of the disruption of healthcare for people living with NCDs, whether it's late diagnosis, postponed treatments and surgeries, interrupted access to your medications, interrupted mental health care, it might well be, very likely, even bigger than the toll of the pandemic itself. So this is something that we're very conscious of. Two more things to briefly mention. The pandemic obviously imposes very severe anxiety on people living with NCDs who are well aware that they may be more at risk, especially those who can't afford to isolate, can't afford to work from home, and are worried also about their livelihoods and losing their jobs. Evidence is also emerging that long COVID syndrome or post-COVID complications might significantly swell the numbers of people living with NCDs, even beyond kind of the waves of the pandemic. So we're seeing evidence of neurological disorders, kidney, cardiovascular and lung disorders, as you might expect. But we might be left with some very long-term changes to the NCD community as a result of the pandemic as well. And then finally, responses to the pandemic, this is something you alluded to, lockdowns, social distancing, and so on, might be exposing us to the common risk factors of NCDs even more so. So lack of physical activity, increased access to junk food, restricted access to healthy foods, increased alcohol use, perhaps increased tobacco use in some contexts, but also loneliness, anxiety, depression. So NCDs absolutely need to be front and center of how we both recover from the pandemic, but also how we better prepare for future pandemics and future health threats. They need to be central to national recovery and response plans and future preparedness. We know, unfortunately, this isn't the case at the moment. Only a handful of countries, I think 16, have reported to WHO that NCDs are being centrally factored into national response and recovery plans. So clearly we have a long way to go. And it's great that you've initiated this discussion today.
Thank you, Nina. And you're so right. As in, I feel like the pandemic has taken us back by so many years, the progress we've made in NCDs. But I think one thing good, if there was anything that's come out of this whole pandemic, is that the focus has shifted a little bit on mental health. And I'm going to bring Lee in here and ask you, Lee, as a person who has been living with mental health troubles, and I want to understand why should we focus on mental health, not just during COVID, but also otherwise? I think you would be in the best position to explain this to us.
Thank you, Ria. I'm glad I can join this discussion session. So in my opinion, before COVID, the situation in Malaysia actually is difficult, but COVID actually exacerbate the situation because it brings uncertainty and additional stress to the people. And with the physical distance, isolation, and feeling of loneliness and depression actually create more mental health burden to the public. And besides, now the health resources in Malaysia actually have been shifted more to tackle the pandemic issues. So other health services, including mental health, have to compromise up to an extent. For instance, appointment and medication to hospital might be delayed, or you have to wait for a long time compared to previously. Maybe you will wait 1 month, you can get your treatment and medicine, but now maybe you need to wait 2 months or more. So, and based on, there's one people living with Malaysia advocacy agenda, which is we collect their opinions and challenges with people living with NCDs, with others 11 chronic disease. So what we share the common challenges is the slow diagnosis, and the access to the health service is not accessible sometimes, that you couldn't find a way to access the health service.
Thank you, Lee. And so, and from what I understand is, although, you know, we're sitting here and thinking that the world is focusing more on mental health, the situation on the ground seems to be very different, with people not being able to access, you know, doctors and therapists. And thank you for highlighting that, Lee. And I think there's a huge disconnect with what we think the reality is. And thank you for sharing those insights. I think that's very valuable. I'm just moving on to Austin. Austin, since you are an absolute expert at universal health coverage, I'm gonna bring you in and ask you, why do you think that universal health coverage is important in strengthening the NCD response?
Right. So first of all, I mean, NORAD's principally looking at countries, you know, the lower income countries. And so much of what Nina has talked about is sort of at the global level. And I would say for many of the countries we're interested in, it's not about COVID having interrupted NCD services. They don't exist. So what is universal health coverage? Just in case the audience doesn't really understand what it is. It's really about the interplay between three factors. One is deciding what services you can provide and prioritizing that so that everyone gets access to the services. So that's the second interplay, is the equity function. Can everyone get it? And the third interplay is, how do you finance it? Are we going to rely on people using money out of their pockets? Or will government be the sole provider? Or is there something in between with insurance companies and stuff? And basically what you're trying to do is move away from point of care financing, because that's very ineffective. The people who have lots of money buy too much care, it's not really needed, and the people without money don't buy enough care. So you get very ineffective healthcare if you do out of pocket. So you want to pool financing somehow, and the extent and how you do it. But what that means when you're talking about equity and priority setting and financing, it's evidently a very political, it's a very domestic agenda. It's not something you do or you don't do. It's something you progressively achieve over time. So this is a long-term agenda, and country, like I'm from the UK, even though I'm working in Norway, but both Norway and the UK are still working on progressive realization of UHC. And some rich countries are further along. So UHC indexes in some of our countries are quite high, and other rich countries are actually quite low. But every country can do this, and it is about saying, how much do we have, what resources do we have, and how can we use them to offer the best value for money, the best equity, the best quality of care to our population. And if you think sort of a rule of thumb about primary healthcare that's often talked about primary healthcare is that it should deliver care close to where people live for roughly 80% or 85% of what people need. Nowhere in the world anymore does that exclude NCDs. In all countries, NCDs are on the rise, and in all countries, NCDs are a significant proportion of the disease burden. And if we're unable to help people realize what the problems are and how to tackle those problems, our primary healthcare systems are failing, and they will be considered less and less effective, less and less legitimate, and it undermines the whole basis of the healthcare system and the effectiveness of the healthcare system. So for whatever reason you're trying to invest in healthcare, whether it's for social capital or whether it's for efficiencies and economy, all of those reasons mean that the healthcare systems have to start considering inclusion of mental health and NCD care within their packages.
Thank you, Austin. And it's interesting that you brought up politics, because this ties well into my next question, in fact, for Nina, because you know, we had a UN high-level meeting for NCDs a couple of years ago, and every time there is a UN high-level meeting, there's a lot of hype around it. There's a lot of preparation. All the member states are very excited to attend it and all of that. But I know, because in fact, I attended the UN high-level meeting on tuberculosis, which is happening around the same time as the NCD high-level meeting. And And it's just that as soon as the high-level meeting is over, there's just a drop in enthusiasm, and people have pretty much forgotten what they committed to just a few months down the line. And I'm just curious, Nina, as someone who is in civil society, how do we ensure that there is accountability to these commitments that have been made during the UN high-level meeting?
Yeah, I mean, as you say, governments have made many previous commitments to act on NCDs. There are targets for 2025, so essentially just around the corner. And for 2030, there's a specific sustainable development goal on NCDs. Those require governments to take action, both on the main root causes, the drivers, the risk factors of NCDs, but exactly what Austin was just talking about, also to improve access to essential medicines and healthcare in all contexts. There's been progress in some places, but less than 20 countries are on track to meet the global NCD target for 2030 right now. And that's about reducing premature deaths by 1/3 by 2030. So, I mean, this is as bottom line as you can get. It's about saving lives from the major NCDs, but fewer than 20 countries are there right now. We were involved in a study, NCD Countdown 2030, which reported last year, which showed that all countries can still make it. There are trajectories, there are tailored policy packages to make sure that all countries, it can still be feasible to hit that target. Obviously, COVID makes that more challenging, but it also makes the case much more urgent. And I hope that it's a moment also to increase the accountability. What we're seeing now is COVID-19. It's really exposing the consequences of having not adequately invested in health and health system strengthening. And there has to be increased accountability for that. So decision makers, and especially the people that hold the purse strings, the finance ministries, need to understand and be confronted with the fact that the toll of the pandemic is related to the failure to kind of mend the roof while the sun was shining and to strengthen our health systems. And that, exactly as Austin was saying, the biggest needs now of populations, even in the countries where the poorest billion people on the planet live, the biggest needs that people have are now NCDs across the board. I think we're learning that the NCD prevention and care isn't a luxury. It's too often been seen as kind of a nice to have once infectious diseases are taken care of, kind of once the Millennium Development Goal themes have been prioritized. But actually what we're seeing is, they're interrelated. There's an interplay between infectious diseases and NCDs. There's an interplay absolutely hand in hand, maternal and child health and NCDs. So really action on NCDs and NCD care has to be seen as an essential foundation of sustainable and stable health systems. Really, this is about the future sustainability of health systems, whether they can weather storms like this in the future. So NCD action is absolutely indispensable to resilience, also against infectious diseases. But we're thinking about other health threats as well. We have to look further out. We're obviously extremely concerned about things like antimicrobial resistance, so resistance to antibiotics, for example, or the health challenges that are going to come with climate change, or that are already manifesting with climate change. So it's been made really painfully clear by the pandemic that governments have to do better in the future and kind of build back fairer for everyone, all the people that are already living with NCDs, but all of us that are at risk of NCDs in the future as well. So, I mean, really central to creating that accountability is involving civil society and involving, exactly as you're doing today, involving people with lived experience, people with NCDs in a meaningful way in decision making at every level. So, if we were listening to our civil society, if we were listening to people's health needs, our health systems would look very different. So this is the reason why the NCD Alliance, we work with 65 regional and national alliances all around the world, including Lee Yin's organization in Malaysia. So, and we aim to, support engagement in policy making and change at national level, whether that's people living with NCDs advocating for their own policy agendas, as Lee Yin was saying, or really engaging in national consultations and so on, giving credit where it's due, where governments are doing well, or providing critique and proposals for improvement where there's inaction on NCDs. We also, as part of that, we coordinate an annual global week for action on NCDs. As you were saying, we timed this in September to kind of capitalize on the buzz and the preparations for the UN General Assembly meetings. But we started doing this every year because it's a fantastic opportunity for advocates, the communities, people living with NCDs to really remind the leaders of the commitments that they've taken in front of the UN. And this year our theme is going to be community engagement this September. So if you want to look at actonncds.org, our website, you can also see ways to engage in your communities for the Global Week of Action this year. So this for us, creating that accountability, having the community and people with those lived experiences engaged and involved in decision making is absolutely essential to how we're going to build back from the current crisis.
Thank you, Nina. And I think I really appreciate that message of hope, because I feel that's what we need right now. We need to know that, okay, you know, we didn't do as well as we should have, but that's done. And now we can still get back on track. Governments can still do better. And thank you for that call to action as well. I think that would really help our listeners to understand what they can do to help the NCD response at this moment. The next question is for Lee Yin. And Lee, I'm just wondering, you know, as a person who has the lived experience of going through an NCD, what do you think that the governments need to do to improve the situation, specifically on mental health? Because like you said with your earlier answer, you know, not much is being done on the ground at this point. The ground realities are very different. So what should governments do to do better?
Thank you, Ria. From what I have experienced, that what government needs to do is, of course, first, I think the most important would be raise the awareness among the public. And regarding awareness, I will point to two, which is self-awareness and public awareness. Why this awareness is important is because mental health issue is very hard to diagnose. And most of the people in Malaysia does not equip the knowledge regarding to the sign and symptom related to any mental health issues. So when the people is not aware, so when they might need help, but they didn't know, so they couldn't go to the proper space to seek help. And in my experience, because of I have the awareness when I know I might need help, I actually went to the clinic of my uni, and he suggested me to refer to a counselor first before I just went to. So I went and I talked to the counselor, I do the questionnaire, and I got the marks, which is proof that I am depression. I even cry when I talk to the counselor, but the counselor, after seeing all this here, he just tell me to, you know, go back home, try to hang out with friends or watch movie or do anything, then you will be fine. So I think this is the first time that I feel really hopeless.
Yeah, but Leanne, what you're doing right now is so powerful, because by sharing your story and letting it out there, you are empowering so many people who are going through the exact same situation that you are. And I think it's about time that people actually stand up and listen, that it's important to get the community involved in every step of the way. And that's exactly what you are doing right now. And I am truly proud of you for speaking out and telling us your experience. Thank you very much for sharing, Lee, and it's going to go a long way in our advocacy efforts.
I just hope that at least the related career like counselor, psychiatry, or psychologist make these services more accessible to the public and reduce the rejectness. At least don't reject them when they are seeking help. It's because that's the only time I went to seek help by myself. After I got the reject, I was like, okay, maybe I'm
but Leanne, it takes so much of courage to stand up and say, you know, I'm going to go see a doctor. And then when a doctor is making light of a situation, and I know it's very hard, but you know, at the end of the day, that's your message to the world, that, you know, take mental health seriously, because it's not something that it's a serious issue that people all over the world face. And thank you for sharing, Leanne.
And because of COVID, actually, well, one thing good about COVID maybe is actually raise the stakeholders to notice that the importance of taking care of mental health, but the awareness is still not enough. And also the government actually need to organize more campaigns or platform for the people living with NCD, so that they have a platform to share their challenges and their experience. And also it's one way to break down the stigma of the community towards mental health.
My real wish, Lian, is to have people like you lead the NCD response. So I look forward to seeing you do that. And it's just amazing what you just did with sharing your story. And thank you for helping so many people through your experience. I'm going to move the next question to Austin. And Austin, as someone with a policy background, I'm just curious to understand, what is the link between NCDs and poverty? Because a lot of people, particularly in the developing world, are living in poverty. And what is the link that you see? Okay,
so it's estimated in 2015 that 90 million people were pushed into extreme poverty, what we call iatrogenic poverty. It's caused by expenditure on healthcare. And from 2000 to 2015, it's estimated that 9.4% of households up to 12.7%, so it's increasing, are spending more than 10% of their household budget on healthcare expenditure. So healthcare is a really big driver of costs at the household level. So healthcare consumption can impact on poverty at the individual level. It can definitely impact on household poverty, because if you're spending so much of your budget, then kids don't get to eat, or they don't get to go to school, or they don't get shoes. It impacts on community level economies, because certain people can't participate. It acts on corporate level. Businesses, they lose, who do they lose? They lose 45-year-olds, 50-year-olds, people who've been trained to do their jobs and who have many dependents, both old and young, who are dependent upon them. And of course, that aggregates up to the country level with massive losses of human capital and massive inefficiencies in healthcare expenditure. So we've got to remember that in the poorest countries, the poorest organized health financing, so over 50% of health expenditures is out of pocket. And people in poor countries are facing the highest costs. So either they don't get to go to any kind of care because it doesn't exist, but if they do, frequently it's poor diagnosis and prescriptions. I think Margaret Crook has shown that there are more deaths caused by poor quality care than by lack of care. And then once you've got your prescription, you have to go and buy it. It's often a much more expensive drug than you would normally have. But people in poorer countries, because there is no regulatory protection around quality of medicines, they tend to try and buy branded generic medicines, which are much more expensive. So partners like Resolve to Save Lives have estimated in some of the project countries they're working in, most people are facing costs at 300 to 2,700% of what someone like me, if I have to buy those drugs in the UK. So you're extremely poor, you're getting really poor quality care, and then you have to pay through the nose to get it, partly because of the lack of availability and the unregulated private sector, but also partly just because of lack of regulatory control by government, which assures people access to quality drugs at a reasonable price. So it's a huge poverty issue. It's a huge driver of poverty, and it's a huge inhibitor of national development. So at every level, individual, household, community, business, national.
So as a person who's living with an NCD in an LMIC, Austin, it just seems like I'm getting a raw deal because I'm paying catastrophic costs for my healthcare and not getting the quality that I truly deserve.
Absolutely. And the other thing you have to remember is 50% of morbidity comes from exposure to risk factors. And the private sector is not investing in risk factor reduction. The private sector is not investing without incentives or punitive. They're not going to bring down air pollution. They're not going to change your exposure to salt and sugar and trans fats in your diet. They're not going to stop selling cigarettes. They're not going to stop selling alcohol. So unless you have a public sector involved in prevention and promotion of good health, and then regulating and creating standards around the quality of care, yes, you're getting a really bad deal.
Yeah, and I think my take home from that is we need strong regulatory practices at a national level and a regional level, so to ensure that situations like that don't arise anymore. And Nina, just to tie to Austin's answer, how do you think we should promote inclusivity and equity in our approach to NCDs?
Several ways, and without repeating what Austin said, because I don't think I can phrase it any better than that. I mean, first of all, by listening to people and their needs, listening to people's healthcare needs in all contexts, and especially making special effort to reach out to marginalized communities. Exactly as Lee Yin was saying, stigma is also a barrier that needs to be tackled when we're talking about NCDs, when we're talking about mental health. So inclusion of those communities very deliberately in the decision-making process, and people living with NCDs, to ensure that the policy responses are designed to be, you know, as tailored to them and as effective for their needs as possible, and accepted by the communities as well, is extremely, extremely important. I mean, it really has to be, it's a long overdue wake-up call. You know, COVID has really exposed global inequities and how they operate via NCDs. As Austin was saying, kind of the risk factors that drive, you know, almost a majority of cases of NCDs in all contexts. And, you know, those risk factors are becoming rapidly more and more globalized. Air pollution, for example, as a major driver of NCDs, also in the poorest communities in the world, rural and agricultural communities, as well as the big cities that we always associate with, you know, lung health conditions and respiratory conditions and so on. So it's also junk food, for example, also, as Austin was saying, exposure to alcohol. We see, you know, not only is these private sectors, kind of the health harming commodity industries, failing to invest in prevention of NCDs. They're, you know, in our work, when we're doing advocacy around NCD risk factors, there are many, many tried and tested policy solutions. Some of those are economic instruments like stripping back subsidies, which, you know, the alcohol sector, junk food sector, tobacco sector still in some parts of the world profit from, or introducing, you know, health levies and taxes, things like minimum unit pricing for alcohol. All of these things are shown to be vastly effective. They can also, of course, entail huge savings for your health systems and even generate revenues that could be used back to, you know, advance primary healthcare and UHC in an ideal situation. So there's a lot that could be done by tackling those root causes. And we know that 40% of cancer cases, obviously the majority of cases of type 2 diabetes, cardiovascular disease, lung disease, many incidences of dementia, these can all be prevented. But we're not doing that at the moment, in part because, and we see this in our day-to-day advocacy, those health harming industries are very, very strongly lobbying against working with governments that champion inaction essentially around these things. We've seen this specifically in the COVID response that you know, the alcohol industry, the junk food industry have used this as an opportunity to lobby, to ask actually for even more tax breaks, to ask for being able to do things like 24/7 alcohol delivery to people's homes, and then it's more difficult to enforce things like age restrictions and so on and so on. So it is very, very worrying to see how those industries, not only they're not playing ball, but they're actually working against the causes of health. And increasingly in low-income country contexts as well, we see the alcohol industry lobbying very, very heavily in countries in the ASEAN region, Southeast Asia, to get more access, you know, to communities that have not traditionally been, you know, big consumers of alcohol, because they see these as growth markets. As a result, you know, alcohol consumption in some world regions is actually going up, whereas alcohol harm, we have global targets that should be taking this down. Obesity and overweight going up around the world. Diabetes, including type 2 diabetes, 70% increase in deaths from diabetes just since the year 2000 worldwide. So we're clearly going in completely the wrong direction when we're talking about some of our NCD indicators. When we do have kind of tried and tested policy solutions, the WHO recommended policy interventions and best buys, which are proven to be effective, we need more of those. We need development of best buys around air pollution, especially ones that can be tailored to low and middle income country context as well. But yeah, the solutions are absolutely there, but we do have this barrier to get over. We have to call out the health harming lobbying that's being done by some of those sectors. and we have to find new ways of dealing with it. Obviously, there's the Framework Convention on Tobacco Control, which is there, or one of the articles in that is supposed to prevent the tobacco industry interfering with health policy making. But at the moment, there's no equivalent for the alcohol industry. So the alcohol industry feels like they have an open door to health ministries to lobby against some of these tried and tested measures. And the junk food industry as well, we're seeing that increasingly around the world. At the same time, it goes hand in hand with, you know, exploiting new ways of reaching new markets, whether that's new markets geographically or new markets in terms of new generations and youth who are being reached out to via social media. So a lot to do on that score, but we do know that all of these things. Sorry?
It just seems like we need to invest a lot more in preventive measures, right? Like as in
the case for investment in, you know, you get a return of 7 to 1 in the low and middle income countries if you invest in prevention of NCDs, according to a WHO study from a few years back. And that case, I think, is even stronger now, because if you think investment in NCDs is also an investment in health security and future pandemic preparedness, then actually this wasn't factored into the kind of cost-benefit assessments previously, but hopefully will be in future to kind of make that investment case even stronger. And all of this means that, you know, you have more of a chance of managing demand for healthcare. You have more of a chance of, you know, making the budgets available for people to be able to access healthcare, as Austin said, in the community's primary healthcare where and when it's needed.
Thank you, Nina. And I know, I see we're running out of time a little bit, but I want to ask Leon a very important question. And Leon, just what is the role of stigma in NCDs? You briefly touched upon it, and I just want to understand, how do you see it affecting people who want to access care, especially in mental health?
Okay. For the stigma that I have experience before, like from one of my friend, he tell me that when once he know that I went to hospital for psychiatrist for my depression treatment, he said, her mother tell him to not go, as your CV might shows you have depression and it will affect you to find a job. Just and also any other stigma that they always think that we are abnormal, but actually we are just sick and we just need to go to hospital to get treatment just like any other disease. But many people doesn't take mental health issues as a sickness, but more to maybe you are psycho, that kind of area. So it's important for the community to know what actually mental health is, as the depression or anxiety is just like a taboo in Malaysia. You won't see people will discuss anything related to this topic. So I just hope by my experience I can raise more people. Actually, it's okay to share your story. It's not that scary. And then you will find out that actually there's so many people that have similar experience just like us. And for and also not actually the challenges that I face not only just occur in mental health, but also occur in other chronic disease. Because based on the Malaysia advocacy agenda, that when we talk with another 11 chronic disease, the people, what they face the challenge same as me, which is difficulty in access to the health service and also the delay of diagnosis. A delay of diagnosis will be a big problem, as some of the disease that once you delay, it will make your condition getting worse. So
thank you, Leon. And it's amazing to me how in 2021 people still don't view mental health as a serious issue, and I hope everyone who's tuning in today listens very carefully and takes mental health very seriously, because it's something that can affect any of us. And we have bold people like Leon, who is holding the torch and talking about it. And it's time we take this issue very, very seriously. We have 5 minutes left to end this talk, but I'm going to move to Austin right now. And Austin, I just want to know what you think government should do to tackle the overall threat of NCDs. What can governments do better that they're not doing right now?
Well, I mean, ultimately, disease shouldn't purely be an opportunity for private companies to make a profit. So a public authority needs to protect the interests and the well-being of the public, whether that is from invasion of another country or whether it's, so the public health is an important area of public authority responsibility. And I would say there are kind of 4 interconnected areas. And we often, in global health, we often think about trying to finance programs to deliver vaccines or care. And I think we've underthought the realm. But so we mentioned already regulation. Regulation is extremely important, both within the health sector and outside. So regulating emissions for air quality, or regulating the behavior of private pharmacies. You can't just sell any drug to anyone. Or regulating the quality of drugs that are coming into the country. So regulation is really, really critical. Without offering anyone a service, the public authority can provide enormous benefits to public health through regulation. The second thing is, we've talked about public health. We've got to prevent and promote good health and not just treat the symptoms of ill health. And that's very cost effective. The third thing I think is on this UHC thing that we talked about right at the beginning, so returning to the beginning, I think we need to move towards standards of care and make sure that those are available to everyone. So define simple, feasible, effective care standards, work out how to offer them throughout your health system, make sure that the drugs and the services are available and well supplied and at affordable price. And then, and is that with private companies or not? It depends on the country. You can use the private sector to deliver part or all of that, or you can have a largely public sector delivery system. That's not so important, but it's really important to move towards quality standardized care. And the last thing, as I mentioned, is the reform of finance. People shouldn't be buying care out of pocket. People should be buying health insurance, or there should be a single public provider who's providing it. And that doesn't mean that all care is free for everything, because the poorest countries have $7, $8, $9 per capita per year. You can't buy everything. You have to set priorities. But you need to pool the finance, and you need to be able to cross-subsidize so that the sickest and most unable to pay also have access to care for the most critical things. So there's 4 things. I'll just repeat them. Regulation, promotion and prevention of good health, pooling of finance, and then progress on equitable, affordable, quality care.
Thank you, Austin. That was very clear, and we heard it loud and clear. And I'm moving to Nina. Nina, you have 1 minute to summarize what your thoughts are and what you want to tell governments of the world.
I think the kind of trigger for today's meeting was a joint letter that we wrote together with WHO, UNICEF, and the Norwegian Ministry of International Development, and that was all about investing in healthy populations. So I want to pick up on that financing point that Austin just talked about. So COVID creates really a long overdue sense of urgency for NCD action and investment. We're talking about nearly 1/4 of the global population that live with NCDs, and yet NCD action, prevention and care has been thought of maybe for far too long by governments as an afterthought, as a nice to have, whereas it really is fundamental to your resilience, preparedness, security and economic stability. It's not an either or with infectious diseases. It's not an either or with maternal and child care. In fact, if you have people-centered health systems, you need a recognition, and we need more data, but there is increasing data that people often live with both. You may be a woman living with HIV, which puts you at more risk of developing cervical cancer or having a heart condition, for example. You may have tuberculosis, and that puts you at a much higher risk of developing diabetes, and vice versa. There's a bi-directional relationship there. So it's, a reality to look at global health needs and stop dealing with global health priorities in completely separate silos with completely different funding programs, because you're maybe driving inequities. That we heard a very emotional story from a young woman living in Kenya who that exact scenario happened to her. She was living with HIV. She had a good level of access for antiretroviral treatments. But it was very difficult to get screening for cervical cancer. She developed cervical cancer that developed into other cancers, and then it was very, very difficult to access the care and treatment, cancer treatment. And in the end, the outcome of her story was a happy one, but it's because she had healthcare provided by her employer at the time, who was MSF. And for the vast majority of people in Kenya, women in Kenya living with HIV, that story would have ended very, very differently. So you end up with inequities just within global health priorities and systems. So it's made it abundantly clear that NCDs are the weakest link in health systems at the moment, and that we can't delay that decision to invest. We have to start doing things very, very differently in the way we make investment decisions. That's not to say less to other global health priorities. That's to say, let's level up for NCDs and recognize that all the other global health communities, whether it's TB, malaria, HIV, maternal, neonatal health, these are all affected by NCDs as well. So we need to make a stronger case for integration and investment support.
Thank you, Nina. And Nina, I'm actually going to do this a little differently. Instead of giving concluding remarks from my side, I'm going to hand over the mic to the most important person in this room, that is Lee Yin. And Lee Yin, I want you to tell us what you want governments of the world to hear you say. What do you want governments of the world to do better for mental health? Lee Yin, are you there? So thank you very much, everybody, for joining us today. A very special thank you to Nina, Austin, and Lee Yin for your participation in today's FORESIGHT Global Health Talks. I think I can speak for everyone by saying that this has been a super enlightening conversation. So thank you, and we'll see you next time.
Thank you.